Hello and welcome to the New Indian Express. We have heard many times that a doctor is equivalent to God as he is in the business of saving lives. But in Madhya Pradesh, a cardiologist has cheated his patients and their faith in him. 7 people allegedly died under his treatment, and this also allegedly includes the deputy speaker of a state assembly. Now, the real shocker in this case is that this man has had prior cases against him, and he's still got to be a cardiologist at a prominent hospital in Madhya Pradesh. In the wake of this issue, we are left doubting the medical profession. Today, we will be talking to Professor Dr. J.A.Jayalal, who is the Secretary General of the Commonwealth Medical Association in UK and was a former national president of the IMA. He will share his views of medical quackery in the Indian medical system. Okay, sir. Now I'm very sure you must have read out about the Madhya Pradesh fake doctor case. Now, in your experience, do you feel that there are a lot of fake doctors like this in the Indian medical system?
Absolutely, it is not a new thing. It is for a lot of decades or in the not only in the metropolitan cities, but more so in the second tier and third tier cities. There is a lot of people working with the clinics and small clinics. This what is little on the higher side because it was impostering as a cardiologist or cardiothoracic surgeon is a relatively rare. There are habitual offenders like this are roaming around in the country. They roam from one hospital to another hospital. They get out and easily get into that. Unfortunately, the per se the system of our legal system do not have much strong the teeth to bite them, because even if somebody who is without any degree practicing, if he is caught, and he can pay a very nominal fine of 500 to 2,000 rupees and get away from that. So this is a chronic issue. This is a rampant issue. When we say there is almost 14 lakh doctors of modern medicine here, almost equal amount. I mean, 10 lakhs quacks are there in different parts of there.
Okay, sir. So, how is the verification process of a doctor's documentation? How does the recruitment happen? How do you verify the documents of where he has studied, where he has done his degree? Do you feel that the verification system itself is flawed?
Yeah, absolutely. In this issue, there is a drastic failure on the part of the management or whoever given the appointment. Because now we are slowly building a robust system of identifying a doctor, because with the certification process, but each state, a doctor, if he needs to practice in a particular state, he needs to register himself with all his credential original certificate to the particular medical council. And most of the majority of the state medical council, that is, you need to re-register yourself for once in 5 years. So long or the days when we once register, lifelong we register, and even if they're dead, their certificate somebody else may be using that. But here now we have a system that we need to register every there, and meantime also you need to get some of the credit hours of learning or upskilling yourself. So it is mandatory that, and more so if any doctor from abroad who is not done his graduation here or he studied foreignly, he wants to come and get a practice somewhere, even if it is a remote corner of the place. The law says that he needs to get the special permission from the National Medical Council, that is an all India level. So in this case, it looks like they were imposing like a foreigner, a famous cardiothoracic surgeon, and the hospital allowing him to practice without the special permission from the NMC itself is a flawed one. So now it is mandatory. Anybody who are going to appoint, you need to do the pre-check. That means his previous hospital or previous place of work has to be incurred, and that has to be documented in the file, especially after the Immaya case in the RG Kar Medical College in Calcutta. The government of India has sent the circular to all, and any new staff who are enrolling, you need to have a antecedent check has to be done. So here, I believe this hospital has not done the antecedent check. They have not verified his degree, because if you see all of our medical certificate, I have a medical certificate. It will have a QR code. Anyone can put a QR code and read, and my entire history will be there in the QR code, and where I have finished, in which college I have studied, all that details. So miserably, somebody has failed it. Somebody has passed all these things and given this job. I think here it is not my intention to point the fingers at somebody, but the system has failed here, absolutely resulting in unfortunately the death of quite a lot of people.
Okay, sir. Now, what has happened here is a major institutional oversight, as you said, on the part of the hospital itself. Now, India, if you look at India particularly compared to all the other countries, we actually face a shortage of doctors and specialists. Do you feel that this could be one of the reasons that a large number of these fake doctors have come into the system?
Absolutely no, sir. Because unfortunately, we are telling this again and again. There is lack of doctors, and every year, understand in India, we have now 777 modern medical college, and 1,30,000 doctors are coming out. We have nearly 80,000 specialist doctors are coming out. Apart from this, there are nearly 10 lakhs Ayush qualified doctors are there, allopathic and other system. So we have enough number, but unfortunately, there is no skew distribution. They are getting concentrated on a particular place. They are not going to the particular place. There are a lot of reasons. One is there is no infrastructure facilities, the administrative failure on the part of the government in giving a proper appointment, a proper the job to them. They do not have a system of annually putting the people. So definitely there is enough of doctors are available here. Specialists are available. Slowly it is becoming, but that is not the way. But if there is no pilot for a flight to run aeroplane, you can't make a taxi driver or auto to put that. So it has to be a doctor is a process. You need to be get trained and become a specialist, and you need to come in. And if our country system is not able to check that, and anyone can sneak into that, and that is only a administrative failure, a system failure. It is not that the number is less. And in fact, we have much higher number than comparing with many of the other countries. Even our doctors are now flying to most of the Western countries. If you see UK, USA, Western countries, 30% of our Indian doctors are there. So we have enough doctor. Our system is not uh, appointing an adequate of people, and that has to be changed. And this is not only this. And you as a though I am a senior doctor, and if I am entering into an hospital, I'm not sure my doctor is a qualified one. I'm not sure my staff who is going there treating is a qualified staff. The pharmacist is a qualified pharmacist, because the lack, the shortage of the nurse and the pharmacists are rampant. The fourth, most importantly, I am not sure my drug which I am going to take is a pure drug. The spurious drugs and fake drugs which are running in the market is enormous. It is so. In comparing with, I represent Commonwealth Medical Association as the president, and I have seen the medical system in other countries. Probably yes, in the US and UK or even these African countries, you may not be able to reach out to a particular doctor very immediately. You may need to wait. But what is happening here? But the difference, major difference, the quality of care, the uniform standardized care, any place, anywhere you will be get in a particular hospital. There may be delay, but here in India is one country where we have this uniformity is not there, the standardization is not there, the monitoring is not there unique, and a lot of loopholes are there. So slowly we are marching ahead in a positive direction. Maybe it takes years and years to see to that, and anybody can walk happily into an hospital with the confidence that I know this doctor is a qualified, I know this hospital has only concerned specialist, qualified specialist working here, I know that the drugs being sold in this hospital is a pure drug. And that is, I feel, it is a pure democracy, pure independence for an individual. But we need to walk miles and miles to reach that area.
Okay, sir. Now, as we are talking about the government, sir, now in this Madhya Pradesh case, one thing the hospital claimed is that this doctor comes for is appointed. He came through a government authorized agency. Do you agree that it's a fault of the administration itself that even from a government authorized agency? In your experience, have you seen cases like this where government from an government authorized agency itself faulty fake doctors are coming out?
I have very limited incidents of fake doctors coming, but the fake equipments coming, fake drugs coming, fake things coming mainly through the government agencies. The reason for that is the government always go through the quotation, call for the quotation, and it is a quotation based on lowest quotation will be always accepted. If you give, I give a drug, I'm selling drug for a doctor for 10,000 rupees, and another person maybe 11,000. The government will usually choose the 10,000 person. So that is one of the greatest cancerous event which is there in the government. When we say, well, low quality, low priced item. Uh, Nothing you can get peanut for without any payment. So when you are thinking of that system, that is corrupting. It is not an intentional corruption, but it is a systematically it is doing a corruption and bringing that. But having said that, it is manpower as such concerned. It is the responsibility of the hospital. You are only a vehicle. If an agency is coming at somebody, and it is only a vehicle which is bringing in, but you have a responsibility to verify his antecedent, verify his degree, and check. See, they said the name of a famous doctor in UK, and how much time today with the electronic media, how much time it takes to check that. Just send a mail and asking for that data. So it is absolutely the I will squarely blame as a or the we have in our medical profession a term called vicarious responsibility. Even my staff is doing a mistake, it is I am responsible for that. I cannot say that she's done that mistake, so I mean, can go scot free. And it is absolutely the vicarious responsibility has to be there in the hospital, the management of the hospital.
Okay, sir. Now, for my final question, how do we strengthen this verification process, sir? Do we need more certifications like they do in some foreign countries because in this case, he was a cardiac surgeon, sir. So, do we need more certifications? Do we need more degrees? Do we need more courses? How do we strengthen this verification process so that this mistake does not happen again?
Yeah, there is now most of the Western countries follow an online logbook system. See, if I am a surgeon, I've said that 30 years of my experience, my just click a button, my logbook will show what is my antecedent, how many surgeries I have done. It is not something which I create on the day. It will be there continuously, a logbook of that. Every doctor must be interested to see that they maintain a system and it is uploaded in the cloud. And wherever you are going, it can be verified that your system. Secondly, what we in the Western, if you want to apply for a one medical post, if you see the application form itself, it will have almost 30 to 40 pages. You are applying for that will ask entirely about your curriculum, where you have studied, what you feel, what is your response, something like. But the system where they adapt to put somebody into that work is a very uh, major one. The third, and we should be very clear in our mind, it is only a qualified person should do practice. It is qualified in particular system. In India is one country, we have a lot of systems of medicine. Every system is unique, every system is important. But if you are qualified in a particular system, you should only do that. But unfortunately in India, one profession, one job, if you see, the whole of the population is doing is a medical profession. You ask anybody for a headache, they will give some medicine for you. So that is a way that the profession is going on. And you go to any shop without any prescription, you can buy all the medicines, which is unfortunately it is detrimental to our health. So the government should uh, ultimately it comes because of funds and finance. If you do not have a money, you cannot manage that. If you see our health budget, it is only less than 2% of the budget allocation. If your GDP, if you are not allocating enough fund to ensure a hassle-free a system of monitoring. Now, the postal department, if you see, if I put my letter, post my letter in one speed post, I can trace where this letter is going. That is a level the computer system has improved. So it's not possible for us to develop a system like that. How the drugs prepared in this particular manufactured in a factory is reaching where, tracking that system. How many the doctors, that 100 doctors are coming out of this medical college, where they are going, and that electronic electronic data system has to be improved. Every doctor should be, whenever any job, whenever through way it should be done. And this things like this, and he should be given the maximum possible punishment, and it should not be go, because law do not have a stringent measures in that law. So our the fake doctors or the doctors to that, the quack should be found. In India, I have seen the quacks pay the fee, fine in advance and do that place. One case they do, and next case go, because the legal system is not strong enough to punish this system. At least I wish and I hope this Madhya Pradesh incident will invoke the sense of urgency in the government and all the concerned stakeholders, and they will ensure the stringent and strictest possible punishment is given to this particular fellow. And all those agencies behind this and bringing that, we get information that this doctor, this particular fellow person has worked in various other hospitals also. So that should be screened and should benefited. A government responsible to give a hope to the people. We will ensure when you walk into an hospital, only the qualified doctor will be there, only the qualified nurse will be there, only the standard drug will be available to them. So that is the responsibility of the health, because as per the constitution, health of the people is the responsibility of the government.
Okay, sir. Thank you. Thank you so much for giving such a detailed analysis of so many topics.